working. I couldn't hold a cup of coffee. So.
You don't have to wait on us as much.
They can laugh about it now, but everyday tasks can be next to impossible for someone with tremors. We take you inside the scalpel-free brain surgery that helped fix it all. Good morning, I'm Jessica Lovell and welcome to the Morning Medical Update. A remarkable procedure uses sound to burn the brain, curing tremors in the process. Today, we will see how it helped a father and son. We'll hear from a woman who got the procedure and now wants to do it again. And we'll hear how it all works from a neurosurgeon here at the health system. But first, let's get to our morning rounds. Twice already this week, the air quality in Kansas City has reached hazardous levels, and the recent wildfires in Canada are not to blame. Joining us now is Doug Norsby, the Senior Environmental Planner at MARC, the Mid-America Regional Council. Doug, good morning. How are you?
Good morning.
Good to have you. Thanks for coming in to talk about this with us today. MARC issued ozone alerts twice this week. That makes 9 so far this year. Just first, what's prompting these alerts?
This year we've had a situation where there's been a high pressure area that's developed and been very stable over our location. So that's created perfect conditions for a lot of ground level ozone to develop. It's formed when you have a lot of sunlight, like we get under these high pressure areas, and it reacts with the chemicals in the air. So it's just been unusually stable this year.
We throw the word ozone around. What exactly is ozone, Doug?
So ozone is it's an oxidizer, it's a gas, O3. And up high, it serves us well, but down low, it's an oxidizer. It goes into, when you breathe it, it goes into your lungs, and it oxidizes the tissue in your lungs. So it kind of burns, it kind of does an oxidation burn. So
what's at risk when it comes to our health when these alerts go out?
For adults, healthy adults, it's kind of a temporary issue. You'll notice that it's harder to breathe. You may not be able to, go as hard or go as fast, and there's a recovery period that kind of comes after it. But there's no lasting effects. If you're an unusually sensitive group, if you are pregnant, if you have young children or breathing associated diseases, then it can be more concerning. It can start an asthma attack, cause COPD issues. So really, its focus is to try to protect those who are most sensitive among us.
Sure. Well, we know not breathing is not an option. So how do we best protect ourselves when there's a so-called bad ozone day?
Ideally, if you can, you want to try to make your trips. If you're going to be outside, try to get that done before 10 o'clock in the morning, or wait until after 7 o'clock in the evening. Again, it takes sunlight to create the ozone. So if you get out early in the morning before pollution has a chance to build up, the ozone levels are lower. They usually start to get higher around 11 o'clock in the morning, and then they grow from there until sunset. And then again, as the sun sets and that pollution has a chance to dissipate, those numbers start to come back down.
So Doug, before we let you go, what can we do personally as a community in our area, certainly here in Kansas City, to help improve that air quality? What are the do's and don'ts?
Yeah, so ozone isn't emitted directly. It's a chemical reaction that happens when you have two different types of chemicals that react together. So anything you can do to decrease those precursors helps. One of those is created when you burn things. So postponing mowing, or taking alternative modes of transportation, public transportation, so you're not adding additional emissions into the air associated with that. If you have some painting that you need to do, or you're trying to do something on your deck that would release the VOCs, the evaporative emissions, if they come from gasoline or acetone, thinner, that kind of thing, delay that. Try to avoid that and minimize your use of those kind of chemicals.
Good information, Doug. I don't know if people people knew that. I think we just go out and do what we do, and I don't think it's intentional, but knowing that there's small things that we can do to be better stewards to our environment is nice to know. Just real quick, lastly, how do people check the air quality?
There are a couple different ways you can do it. If you don't want to get kind of a routine notification, you can find that on our website. So it'll be airqkc.org. It's also on marc.org, marc.org. There is, if you want, there is a place to sign up, and you can click that on our website, and you'll get notifications directly from the EPA's notification system, sent as a text message or through email. So there's those different ways. And then on kind of the daily basis, ongoing, if you're going to find you're going to be out for an afternoon and you just want to see what the air quality is like right now, you can go to airnow.gov, and there's a nowcast that will be there and tell you what the conditions are like at that very moment.
Great information. I said I was going to let you go, but I have a quick community question for you, if you don't mind. What about leaving your car parked while it's running? Keeping it off when you get out of your car, does that help?
It does. When a vehicle is idling, it's actually not using its fuel efficiently. So it will produce more emissions while it's idling than when it's actually in operation. So that is true. It needs to be balanced a little bit as far as concern about heat. So, ideally, you don't want to be in where you're going to have to sit in the car for an extended period of time. Just start it up when you're ready to go. When you get to wherever you're going, if you can, hop out of your car.
Yeah, seems like an easy fix. I think we could do that one. Doug, thank you so much for being with us today.
It's my pleasure, and thank you for having me.
Have a great weekend. A father and son had much more in common than they wanted to, and it was making life unbearable for both of them. Janine Kiesling explains how one father's condition prompted his daughter to search for a solution.
That search saved a father and son from continued suffering and brought them here to the University of Kansas Health System for what turned out to be a pretty simple fix.
Stan and Alan Bruce enjoy taking walks together and catching up. In fact, this father and son have quite a bit in common, including their love for the water.
We got a bunch of them sharks up there in Washington.
Yeah. I wouldn't take them off the hook, though.
Unfortunately, one shared trait made many things they love to do impossible. Alan put down his guitar, Stan hung up his fishing pole.
I couldn't hold my arm down, and I couldn't hold it still at all. And this right hand, it just flopped.
As I got older, it just continued to get worse.
You can't eat, you can't carry anything liquid from one place to the other chair, and you have trouble drinking.
At 80 years old, Stan didn't have much hope things would ever improve, but he wanted answers, especially for Alan, who at age 59 had already been forced to give up a career in law enforcement because he could no longer write or use a gun. Stan sought second, third, and even fourth opinions, praying something could be done. Instead, he was misdiagnosed.
I went to neurologists there, and they diagnosed it as Parkinson's immediately. I went to 3 different neurologists, and one of them would say, no, it's not Parkinson's. I would say yes.
Frustrated, Stan's daughter took to the internet. She learned about essential tremors and doctors at the University of Kansas Health System who were using targeted ultrasound to treat the tremors and stop the shakes.
This right one was a lot worse than the left one is now.
Stan left Joplin behind him and headed up the road to 4000 Cambridge Street. His experience was so successful, Alan soon followed.
If you have a chance to get it done, get it done. There's no reason not to. It'll do nothing but help you.
What a great outcome for father and son. Today we are learning more about that focused ultrasound technique from Stan and Alan's neurosurgeon, Dr. Jennifer Chang. How are you?
Good, thanks.
Good to see you. It's nice to see those two doing well, right?
Yeah.
We're also going to hear here in just a moment from another focused ultrasound patient and see her results. Really, really remarkable. But first, Dr. Chang, let's jump in and do some show and tell about how this procedure all begins. you start with a shave. Makes sense because you're going in to the brain area. But how are we prepping the patient?
So we first clip all the hair from the scalp because the hair would interfere with the ultrasound energy. So here we just have these clippers. They're prepping the skin. So we have to place a frame on the patient's head, which serves to help hold the head in place during surgery. So this is the neurosurgeons placing the frame. We anesthetize the skin, and then the frame is held in place with 4 points. And you'll see that shortly. See the little white screws are holding the frame to the patient's head. And then we place this hat, this floppy looking hat thing on the head. And once all that is in place, the patient is then brought into the MRI scanning room and positioned on the MRI table. So that's what you see here. You can see that the patient's now lying down and their head is attached to the table, and then there's an ultrasound helmet. You couldn't see it very well, but there was a helmet that was positioned around his head. So that like orange, clear thing.
So animation, because we can't go inside that MRI room, of course, but tell us exactly how this is being focused, right, pinpointed where you need it.
So this is an animation showing the ultrasound energy being focused on the target. So there's a target within the thalamus, which is deep within the brain, that is the target of treatments to treat tremor. So there's 1,024 individually controlled ultrasound waves that are arrayed in that helmet, and then we can control them so that they focus appropriately on a target. And when they focus there, they cause heating of the brain, raise the temperature in that brain tissue in that small focus spot, and that creates the treatment.
So you and your team are huddled outside of the MRI room. What's happening here?
Yeah, so here there are a bunch of steps that we do, including formulating our target. So we use an MRI of the brain to formulate where the target should be. And then each time we are providing ultrasound energy into the brain, heating the brain. That's done in short bursts, lasting seconds long. We monitor using the MRI scanner at the same time so that we can see in real time what the brain temperature is. So we want to monitor to make sure that temperature stays in the correct range, stays in a safe range, but also achieves a hot enough temperature to do the ablation.
So tell us about how long this is all taking.
So I mentioned, brief sonication treatments. They typically start at about 10 seconds each, and then can go up to 30 seconds. And then altogether, the whole procedure is 2.5 to 3 hours.
So the results speak for themselves, as we know.
Yeah.
We've seen them before, the handwriting test. So tell us about what we're seeing here.
So these are typical tests used to test people's tremor. And you can see people who have essential tremor have a very difficult time, drawing spirals, lines, or even writing their name. So we do this test before, after, and during the procedure. So this is an after video where you can see that that same patient you just saw struggling to write is now drawing straight lines. And
see that name.
Yeah.
I bet that. What do you hear from the patients when they are able to see this in motion?
I have seen patients get very emotional often. And when they're finally able to do something that they haven't been able to do for years, people are amazed, actually.
And there's an there's an MRI from after the procedure, because I want to show that and go into that and show people what we're seeing and what you anticipated to see.
Right. So in the little red circle on those 3 slices from a patient's brain MRI, you can see a small white spot. So that is the spot that was ablated, heated during the procedure, and right in that particular area of the thalamus that again is treated with this procedure to treat tremors. So that is the normal appearance of someone's MRI right after the procedure.
So, Dr. Chang, I don't remember if you remember. I don't know if you know what Stan Bruce told us, but he had said that doctor, when he talked about focused ultrasound, he said he thought it kind of sounded like a gimmick. We know the results speak for themselves, as we just showed you. But do you think other doctors may not fully understand focused ultrasound? Why would he have heard that before he finally got to it?
It's because it's a newer procedure.
Yeah.
So it's been around for less than 10 years. And, where some physicians may have heard of deep brain stimulation, which has been used for decades, the focused ultrasound, again, less than 10 years, and it is not currently widely in use. More and more hospitals are gaining this procedure, because so many people are interested in it. So some people may not have heard of it.
That's true. Stan had some trouble getting the right diagnosis in the first place. Some doctors thought it was Parkinson's, others said it was tremor. Generally speaking, is diagnosing tremors difficult? What's the challenge?
Okay, so just one thing to say is that Mr. Bruce, Stan Bruce, he has both essential tremor and he has Parkinson's disease. And so that there are times when those disease syndromes can overlap.
Or be separate.
Yeah, so some people have, one disease, some people have another, but some people have both, which is the case for Stan Bruce. This treatment, the focused ultrasound treatment, is FDA approved to treat both essential tremor and Parkinson's tremor. So Parkinson's tremor generally presents as resting tremor. Like when you're sitting there, you're not doing anything, your hand shakes for no reason. Essential tremor is more often an action tremor, where when you're trying to do something, you can see the hand shake. So it is really important to see a specialist, a movement disorder neurologist, often to help get the right diagnosis.
So we met another tremor patient, one of your patients actually, who received the focused ultrasound, Carlene Kirkwood. She loves to paint. This is a look inside her studio, just some beautiful, beautiful work. This made it impossible for her, Dr. Chang, just to do, like you said, the simple things. We're talking writing, eating, and in her case, something she loved, which was painting. Her doctor told her about focused ultrasound, and she jumped at the chance to get it done. So Carlene is joining us now on the phone to tell us a little bit about her experience and how she's doing. Carlene, how are you? Can you hear me okay?
Yes, just fine.
And can you hear Dr. Chang? She's sitting right here next to me if you want to say hi.
Yes. Oh, listen, I'm so grateful for her. You wouldn't believe it.
Well, your joy is shining right through to us, and we can hear you on the phone about how life is going for you. Can you describe for us what it was like during the procedure? Take us back. We showed some of that prep work going into the MRI. What do you remember from it, Carlene?
I remember going to the MRI, and I was so comfortable, I think I fell asleep. But like you say, your head gets a little warm, and about 3 hours later, it's done, and it's a miracle.
A miracle, and you're doing so much better now. You told us that there was a side effect after the procedure, that you had some balance problems. Did that continue for long?
No, the first week was, I was really unsteady, but after about 3 weeks it went away, and everything's fine now. Using my hands and painting and even back in the kitchen cooking, I'm just doing great, and I hope to get the other side done next year.
Well, we're going to show some video right now of your two hands side by side. One shakes, one is steady. You mentioned you want to get that other side done, but even with just that one hand, you say you're able to do the things that you love, right?
Yes. Yeah, I can paint. I'm teaching my classes again, and I'm in the kitchen cooking again, and I have absolutely no problem with anything except the left hand.
Well, let's talk about that left hand. Dr. Chang, why can't you do both at the same time? Does it have to do with some of the balance issues?
Yeah, so one concern would be that there could be an increased amount of side effects if we did both procedures, both the right side and the left side at one time. And also it would also take a lot longer. We also know that people adjust and the side effects go away with time. So the side effects occur because there's a little bit of natural inflammation in the brain after the procedure is done. The body senses damage, the heated a part of the brain. So there's a little swelling and inflammation, and then over time that fades away, so the side effects go away. So there's just that recovery period that people experience, kind of like what Ms. Kirkwood was saying. So we feel that it would be too dangerous, really, to do both sides at the same time, because then you could expect to have increased side effects from treating both sides of the brain.
Makes sense. You had mentioned the emotion that you see from patients once they see those, the after effects. What about you? What are the emotions when you hear someone like Carlene just back doing the day-to-day stuff she loves, cooking, painting? Yeah,
it's extremely gratifying. We've really enjoyed being able to do this procedure, both immediately, people see effects immediately, and people leave the hospital happy, but also it's great to see people like Ms. Kirkwood, months later, who are still just enjoying that improved quality of life. And I think that's one of the most gratifying things as a doctor, to see that in your patients.
That's why you do what you do. Carlene, before we let you go, is there anything else you wanted to share?
I want to share how professional they are in the MRI and how kind they take care of you. And it's marvelous that I can do what I do now. And everyone was so helpful.
Well, we're so glad that you're doing well. Promise us you will never stop painting and teaching.
So I'm good.
All right, Carlene, stay in touch. Thank you so much. Have a wonderful weekend.
You too. Bye-bye.
Bye. All right, be sure to ask your questions of Dr. Chang. You can use the chat on YouTube, Facebook. You can tweet us or email the Medical News Network. The information is right there on your screen. Let's get a quick check of our COVID count. Dr. Dana Hawkinson is out this week. So let's get to those numbers. We have 11 total COVID patients, 5 active cases, but 0 in the ICU and 0 on the ventilators. Do we have any reporters with us today? Let's get to our community questions. So we've got a few coming in. Ruth Ellen wants to know, how long has the diagnosis of essential tremor been recognized?
So I don't know exactly how long, but for a long time. Actually, we've been doing, as a community, as surgeons, procedures to treat tremor since I believe the 1950s or 60s. That's a long time ago.
So Jean wants to know, is it difficult to sleep if you have this disease? Now, you said tremor is when it's active, but more Parkinson's. When people are at rest,
people who have essential tremor typically don't have the tremor when they're sleeping.
What about Parkinson's?
Parkinson's, there are some people who will wake from sleep due to Parkinson's symptoms, including tremor. So people who have Parkinson's disease are typically maintained on medications, and you take them throughout the day, and then when you go to sleep, you're not taking medications in the middle of the night, and so some people wake up with pretty bad symptoms.
So Stan and Bruce, father, son. Jean wants to know, is essential tremors hereditary?
Essential tremor can be hereditary. It can be inherited. It can be passed from parents to children. But there are also many people who have it who don't have a known family history.
So Becca has a family member with tremors. How do you become a good candidate for this specific procedure?
So we would like to. We can. See that you've worked with a neurologist and see that you are becoming medically refractory. So tremor is something that slowly increases gradually over many years. So for many people, at first, medication is very effective, and that is, the appropriate first-line treatment. But then if tremor becomes disabling, despite the fact that you are on medication, have tried medications, you could be evaluated for this procedure, and we would just need a referral from the neurologist.
So we heard Carlene chomping at the bit to get that other side taken care of. Terry wants to know, how long will someone like Carlene have to wait to get her other hand?
Right. So that was recently FDA approved to treat both one side and then later on treat the other side. So currently we have to wait at least 9 months between the two treatments.
Let's talk about insurance and the cost.
Sure.
How does that work?
First of all, many people have Medicare who undergo this procedure because many people happen to be in that 65 and older age range, and this is approved by Medicare. It's covered, and then people who don't have Medicare, who have commercial insurances, is typically covered as well. So we occasionally have an insurance company give a denial and just say, well, this is investigational or experimental, which is not. So we typically will appeal those kind of decisions. And we have had some success in doing that. So for most people, it is a covered benefit.
Aaron wants to know, just talk about the relation between essential tremor and Parkinson's. Does essential tremor lead to Parkinson's? Is it a precursor? Are they separate but can overlap?
They're separate, but there can be overlapping symptoms. So essential tremor, as I mentioned, is more the action tremor that we see when people are trying to write, when they're trying to eat or drink. You can see the tremor coming out. Parkinson's disease, tremor is one of the cardinal symptoms of Parkinson's disease, which is typically resting tremor, at least at the beginning. However, Parkinson's disease also encompasses a wide range of other things, primarily in the beginning movement, so slowness of movement, stiffness. But over a long period of time, Parkinson's can also involve other body symptoms and create things like imbalance, blood pressure control issues, difficulty with a lot of other things, and also dementia in the long run. So 2 separate diseases, but there are some people who could have both.
Janet wants to know, how important is it that you get ahead of the symptoms, again, enabling you to be able to get some of these type of procedures done?
Right. I think that, again, good to start with a neurologist for the treatment of these diseases, and to be on medication if possible, because typically these are slowly, progressing diseases. So in the beginning, the symptoms may be very mild. You may not notice them that much in the beginning. And then when they become a little more bothersome, often medication is really the answer, because that will control the symptom enough for you to continue living your life the way you want. But then at that point where it becomes medically refractory, that's the point where, it's impacting your quality of life. You're trying the medications, it's not working. That's when it's appropriate to consider a surgical intervention.
So Robert wants to know, is this the gold standard? Is this the very best treatment for essential tremor?
Okay, the focused ultrasound. I would say that currently the gold standard still remains deep brain stimulation, which is the surgery that's been around for a lot longer.
And explain to people what that is.
So deep brain stimulation works by implanting a thin wire into the brain, so into the thalamus, the picture that we saw where we were aiming the ultrasound beads. Instead, an electrode, a wire, is planted into that part of the brain, and that a device is implanted into the body. So the wire is connected to sort of like a pacemaker, which is implanted under the skin in the chest.
Okay.
And that provides electrical stimulation of the thalamus, and that controls the tremor. So instead of ablating that area, we stimulate the area to control the tremor. So that's what deep brain stimulation is.
So then lastly, give me an example of a patient who would be good for each of these procedures.
Right, so that is can be a good topic of conversation if you were to talk to your neurologist or to meet me. So often people could be a candidate for both procedures, and it depends. There's pluses and minuses, and it kind of is up to the person to understand. Decide which one they want. And then there's also certain characteristics that possibly could rule out a patient for one or the other. So with the focused ultrasound, we actually look at a head CT, a CAT scan, to look at the skull. So the skull could physically make it impossible for us to pass enough energy through to heat the brain. So there's kind of these things that we need to do to assess how appropriate the candidate is. And so again, that's actually a very long conversation that I have many times with my new patients I meet in the office, where they're interested in one procedure or the other, and we talk about what the differences are in detail.
But that's what's key about the healthcare provider that you choose, is that you go in there and you talk through it together.
Yes.
It's a team sport. Last question from the community. Does alcohol quiet Parkinson's and tremor? What's up with that?
So often, and not for every person, but often alcohol could help essential tremor. So that's a kind of common thing that I may ask when taking a patient's history, because I just want to know whether they've noticed that. A lot of people say, I don't drink, or I barely drink, I don't know.
Which is good.
Yeah, and there are other people who have noticed that the alcohol can help the tremor, and either maybe drink a lot or just say,
I don't. Is that a slippery slope?
It could be, and a lot of people just say they don't like it. They don't like drinking, so it's not like they can just drink alcohol all day long to control their tremor. So, but yeah, that is a kind of common characteristic of people who have essential tremor, that often it can respond to alcohol.
Very interesting conversation today. You'll have to come back. There's
Sure.
more to discuss, but let's get takeaways from today's conversation. What do you want folks to know?
I do want people to know that just because you have a disease that's not being treated very well with medication doesn't mean that's the end of the road. There are multiple options. And so I think what our patients did was a very good thing, that they asked their doctors, they kind of did some research and looked for other ways. And then eventually were referred to our system, which is a tertiary health care system. So there are, new technologies, surgeries, and treatments being developed all the time. And so it's always good to just keep an eye open for that.
So it's an exciting time to be you and be in your field.
Yes.
Dr. Chang, good to see you today.
Thank you.
Thank you. And thanks to all of our guests and our viewers for being with us today. Have a great weekend. We'll see you back here Monday at 8. Coming up Monday on the Morning Medical Update, migraine sufferers will soon have a new option. I'm Jessica Lovell on the next Morning Medical Update. Who will benefit from this new nasal spray? And meet the doctor who dedicated his whole career to making the drug a reality. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.